This is a tutorial on how to use SimHERA to simulate an auditory steady-state response testing session where we're going to assess the threshold in an infant case. Now, in BC early hearing programs, we use auditory brainstem responses as the tool for determining threshold in infants, but this is a demonstration to show how you could use steady-state responses. We're just going to open up the SimHERA, and it already has a case loaded, but I'm not going to click on Simulate Case because that will show us the thresholds. So this infant is has been referred from newborn hearing screening, complicated birth, but born full term with no family history of elevated hearing thresholds. We're going to go to the Evoked Response tab here. It is default to set up for ABR, but we're going to go to Auditory Steady-State Responses. Let me see we have stimulus waveforms, and the next tab over is for recordings. I'm going to go back to the stimulus waveforms. These are the default stimuli for the 80 Hz auditory steady-state response testing. We'll just keep them like this, and we'll go ahead and setting up the patient. Now, I've done a video before to show you how to set up patient. I'm going to bypass that and just quickly hit auto apply for the sake of this video to keep it brief. So the infant is set up, and you can see that the EEG is relatively flat. Doesn't have a lot of noise in it, and therefore I'm just going to reduce the artifact rejection limits just in case that baby wakes up, and we don't want to include that into our recordings. Okay, so patient is set up. We've got EEG going on, and we've got stimuli that will be going into the left ear and the right ear. Then we go to recordings, and we check down here to determine what is the intensity we would like to present at. We're going to do a standard 50 dB to start, and that is because this system in SimHERA, as well as many systems that are for clinical manufacturers, they have a one set intensity for the different stimuli. So for each run or recording, we're going to use 50 dB for all the different frequencies, the 500, 1000, 2000, and 4000 Hertz in both ears. And that is based on the Stapel's 2010 chapter recommendations for the normal max levels. So another way to say this, it's the minimum intensity level that we would expect to see a response if they have typical hearing. And for 500, it's 50 dB. 1000 is 45 dB, 2040, and 4040. So we're going to use the highest minimum intensity level at 50 for 500 Hertz. And then we'll move on and go on to do the testing determined by what responses we get. Okay, so everything's looking good, and just double check, inserts are in, yes, and then we can go ahead and start acquiring. And start the session first, and then start acquiring. So you'll see up here that we're collecting epochs, 6, the parentheses, there are 0 rejected epochs. And when this gets to 16, that will be one sweep in which the objective assessment of the statistics are generated. And we can see here that we have stimulus 1, 2, 3, 4, that's going to the left ear, and then 5, 6, 7, 8 in the right ear. And we have the two channels, left channel, right channel. Now you can get responses in both channels with respect to what stimulus you're putting into which ear. So this is stimulus 1, left channel. Also right channel will have an assessment going on. And so that corresponds to this one over here. What we're doing is we're trying to count how many times the response stays in. And if we have 8 out of 10 responses, if we have 8 sweeps out of 10 with responses present, then we would consider that a real response being present, and we can mark that as response present at the 50 dB HL level. And I've seen they've come in for most part for stimulus 2, and I'll be doing the counting as we are seeing it going alongside your recording. So put a little sheet where you can tabulate this for all the different frequencies. And we're meeting noise criteria now for the 4000 hertz stimuli in both ears for the channels, so we can go ahead and stop this. And all the other responses have come in. Now we need to make a decision here in what to do next. We know that the 4000 hertz stimulus should have evoked a response to be present at the minimum response intensity of 40 dB, but we're presenting at 50, so that means that there is some form of hearing loss at 4000 hertz for left and right ears, but we're not sure about the type. Therefore, we need to go to bone conduction to determine the type of hearing. There are responses at 50 for the 500, so that meets our typical criteria, but 1000 and 2000, we also have responses but they are not at minimum response intensities, but they're at least only 10 dB up from minimum response intensity. Therefore, they're likely a possible mild loss. So the more important clinical information would be to determine whether or not there's some conductive component at a high frequency, and then ruling out type for 4,000 hertz. And then we'll move on from there. So we're going to switch to bone conduction. How you do that is go into patient setup, click on bone left or bone right. We're going to do bone left. And to reduce out interactions, we're going to turn off the right stimuli. And we're also going to turn off these frequencies because we're just interested in that 4,000 hertz. So we're going to be testing actually not at 50 dB, but at 30, because that is the minimum response or minimum intensity level in which we want to find a response for typical. So we're going to turn that down to 30, and then we're going to go ahead and acquire and now we're getting to noise floor, left channel, 8 nanovolts, and we've seen no responses in that channel whatsoever. So I'm going to classify this as a no response, and we can go ahead and stop. Now we're going to move on to the 4,000 hertz right and do the same assessment and turn off the left. But before we do that, we've got to go and place the bone oscillator on the right there. And baby's still quiet. Go ahead and acquire. So the left and right channel are down at noise floor with no responses, and have no responses have occurred almost throughout every sweep. So we're going to go ahead and stop, say yes, and we're going to designate this one as a no response as well. Now, for the sake of time and brevity, I'm going to go to offline recording and just do the whole 48 sweeps. It will give you the similar end answer, but I do want you to go through and watch this updating and count your responses that are present and absent across the sweeps. But what we're going to do now is we're going to go up intensity. We know that it's now a sensorineural hearing loss, and we're going to go up 30 dB and then acquire for the 4,000, because now we're searching for threshold for 4,000 for the right, and then we'll also do that for the left. So for the right, we end up getting a no response and very low noise level. We likely would have stopped not at the maximum number of sweeps of 48. We would have stopped a lot earlier. But again, for the sake of this video, we're just going to go to record offline as 48 sweeps. All right, so we can't go up higher than 60 dB HL for the bone conductor. So then we're going to be now going back to air conduction, and inserts are in, and 4,000 hertz. Now we're going to be going up to 90 dB because we're now doing a threshold search. Now for this, we could actually be testing the left side as well. So actually what I'm going to do is, before that, actually it would be more efficient to go to the left and do the bone conductor left, because we wanted to see if there's elevation above 60 dB, our max intensity for the left bone conduction. So we go and acquire that. And again, no response at 60 for the left. So we could go all the way up to 90, and we're going to include both left and right stimuli now, and we're going to go to air conduction. So inserts. So now we're testing single frequency per ear at 90. And the result is we get responses to 4,000 hertz in both ears. So we can choose to, we were at 60, no response for bone conduction. Now we've gone to air conduction, 90. Now we can choose, given the amplitude of these, are reasonably high, at least for, 40 nanovolts, reasonably high. So I'm actually going to go down to 70 and hedge the bets and see whether or not we have responses present. We actually get no responses, so we're going to need to go up to 80. So at least we've established no responses at 70. And we have no responses at 80 as well. So that means that our threshold is 90 for, because we have responses both left and right, will be 90 dB HL for 4,000 hertz. We've established minimum response levels for the 500 hertz. Now we need to determine whether the 1,000 and 2,000 hertz also have minimum response, or have responses at minimum intensity levels here. So if we go back to our chart, we have 40 and 45. Now the choice is, should we do 40 or 45? If we choose 40 and we get responses being present also in the 1,000 hertz, that would indicate that we've at least met that as well. So the wise decision here would be to go down to 40. We're going to go 1,000 and 2,000 in both ears. And if we get responses, 1,000 and 2,000 in both ears at 40 dB, we can consider that this infant's hearing was within normal limits for those two frequencies in both ears. And we're just going to go ahead, let's make sure I've got this correct, 40 dB, stimuli 1,000 and 2,000, and go ahead and acquire. So we did get response being present for the right ear at 1,000 and 2,000 at that 40, and for the left ear at 2,000. Yet the 1,000 is not present at 40. So that makes it easy. We turn off these two because now we're assessing this, and we just need to go to 45 to see whether or not we get a response being present for this 1,000 hertz at 45. And we do, so it's now met its minimum intensity level, response being present. So we have 500 hertz, 1,000, 2,000 within typical limits. So we would consider typical hearing thresholds, but we have an elevation at 4,000 hertz, a fairly steep elevation. So this infant has a steep high frequency hearing loss. Then we go back to the case report and we enter in here for auditory steady state responses. We have in EHL, so we've got to actually correct for that, and the response correction for 500 is minus 15 dB. So that would be less than or equal to 35 for both left and right. And then for the 1,000, it's minus 10, so that's less than or equal to 35. And less than or equal to 35. Well, actually, we got in the right responses at 40 dB NHL, which is corrected to less than or equal to 30 for the right. And then for 2000, that is less than or equal to 30, and less than or equal to 30 for the right. And then for 4000, we had both 90 for left and right ears. And then we put in here our summary of our findings. We can go on and do DPOEs and tympanometry up here, but in this video I won't cover that, but you can wake up the child, do tympanometry, acoustic reflexes, and DPOE if you would like, and then make your recommendations of what to do next. If you are taking these as hearing threshold levels, recommend to ENT for follow-up and possibly discussion for amplification. So let's take a look at how we did. We can go back to the Simulate Case tab and find out the true thresholds. And what we see here, that the thresholds, we did a fairly good job. These are in dBEHL, so they are between 20 and 30. And we got less than or equal to 35 and 30s, all the way up to 2 kilohertz. And then the 4 kilohertz has this really steep sloping high frequency hearing loss, where the right ear we had 75-ish and just around 90 for the left ear. And that matches what we put in with our steady state responses. So that completes the tutorial on how to use steady state responses for determining threshold in an infant hearing case. Thank you for watching.